When it does come to COVID-19 or coronavirus, there are some misconceptions about what's really going on and who's at risk and what we can do to help personalize the, put the risk down on our own. Here to talk more about that is Dr. Josh Redd. He's a chiropractic physician and author who teaches about immunology and autoimmunity to health practitioners. Dr. Redd, great to have you with us.
Yeah,
thanks so much for being here.
Yeah.
So there is this, a lot of misconception here, reality versus what's really happening.
Yeah, there's massive hysteria.
Yeah, let's get into that.
Yeah, so
who's really at risk?
Here's the thing. We have a lot of research and data across the world now, and we have a lot more information than we did even a week ago. The ones who are at risk are if you're 50 years and older with a pre-existing condition. For some reason, if you're 50 and younger, you almost have a 100% cure rate. If you're 30 and younger, the likelihood of you even getting the disease is significantly lower. And a lot of us, we don't know why that is yet, but for some reason the younger population is less at risk. But if you're 50 and older, you have a pre-existing condition, that's something that you absolutely want to do. Now, just giving you an idea, the most common pre-existing conditions, the worst one was cardiovascular disease, and then followed by diabetes. Then obviously followed by lung disorders and problems, which this is a lung-based condition, right? And so it's just going to impact it and make it worse. And then hypertension and cancer.
So with those highest at risk, what type of cure rate are we seeing there?
So here's the thing: you're still having you're having a lot higher fatality rate, which is why if you have a pre-existing condition and you're over 50, there's things that you can do to get your immune system to function, right? If you have hypertension and cardiovascular disease and diabetes, you want to do all that you can do to get your blood sugar levels and your hypertension under control. And there's lots of research that shows if you're eating inflammatory foods and you have those inflammatory conditions, it's just going to get worse. And so if you want to improve, you want to avoid eating those inflammatory foods. There's simple strategies like increasing your vitamin D content. There's simple strategies like glutathione, which is so critical. And then obviously if we are around individuals and we're coughing and sneezing and doing those things, we don't want to obviously visit individuals that are elderly and that have pre-existing conditions. Right?
And that's important because those are steps you can take beforehand.
Oh, you can do that right now before it really spreads and goes crazy, and it could be life-changing. Another big factor, though, is that the two worst countries that have this is Italy and China. And guess what they have in common?
What's that?
They both smoke like crazy. They have some of the highest smoking rates. For example, in China, 50% of the men smoke. And so because this is a lung-based virus, those who are smoking is significantly impacting those. And so you look at the two biggest countries, the two worst countries, which is Italy and China, and that's obviously got to be a factor, right?
Yeah, definitely. So you talked about how we're learning as we go on this. What do you expect to learn about this, and how does that compare to what we've learned up to this point?
Yeah, so
moving forward,
I still feel like things like the flu, if we were to monitor people who got the flu and who's dying from the flu, even this year, it is so severe. I still feel like there is a hysteria going on with this viral infection. I don't think it's as bad as people in the media is making it out to be. However, though, for example, there's like 11 children have died of the flu this year just in the U.S. Up to 50,000 people in the U.S. can die from the flu. So, I mean, here's the thing. If you have pre-existing conditions, you want to be super cautious. If you're over 50, you want to be really cautious as well. Outside of that, just do normal protocol and do what you would do otherwise. Like, toilet paper and water at Costco is not going to help you here, right? I mean, there's lots of things that we can do, but that's the fact, right?
And keep that in mind because no doubt we're going to have more cases come forward in the coming weeks.
For sure. Though it will spread and it will get worse. And the ones who will struggle most and who will need to be more prepared are those that have those pre-existing conditions and those that are over 50.
Okay. Excellent advice for us right there. Thank you so much for your time.
Yeah, thanks for having me.
Appreciate it. All right, we are going to turn